Electroconvulsive therapy, or ECT, has been available for over 100 years. Unfortunately, due to its inaccurate portrayal in movies, as well as misinformation on the internet, many people think ECT is dangerous or causes brain damage. In fact, ECT is a safe and very effective treatment for serious conditions that have not responded to other treatments. ECT is used for severe treatment-resistant depression, as well as other psychotic disorders in people with schizophrenia or bipolar disorders. We will discuss the extensive body of safety data in ECT, but first, let's talk about how ECT works. As with TMS, ECT involves the use of an electrical current. However, this time, small discs are placed on the person's scalp. The patient is asleep with general anesthesia during the procedure, so the patient has no awareness of the procedure. An electrical current is applied to the brain via the discs, causing the neurons to fire. In fact, so many neurons fire that a brief seizure is triggered. Often, it is difficult to tell that the patient is having a seizure because medication is given with the anesthesia that causes the muscles to relax and prevents them from jerking. A trained anesthesiologist is present throughout the procedure. Far from damaging the brain, ECT has been shown to have several beneficial effects. These include improving blood flow in the brain and increasing gray matter, particularly in a region of the brain called the hippocampus, which is important for memory and mood. Research shows the hippocampus may shrink in chronic depression, so ECT may reverse this negative effect. Over time, ECT may also decrease negative inflammatory factors in the brain. Prior to the ECT procedure, an ECT consultation appointment is set up to determine whether ECT is a good treatment for the person's condition. If so, the procedure is scheduled. The procedure occurs at our outpatient procedure facility. After checking in for the procedure, the patient is taken to a private room to change clothes and prepare for the procedure. Once they are ready, they are taken to a procedure room where they are put under general anesthesia to go to sleep. Once they are asleep, they are given a muscle relaxant and then the electrical stimulus is delivered. This electrical stimulus triggers a seizure, which is monitored very closely. As stated earlier, the patient is asleep and comfortable throughout the entire procedure. Soon after the seizure ends, the patient awakes and is taken to a recovery area where they are monitored by staff until they are ready to go home, which typically occurs within a few hours. If you are interested in ECT, please contact our psychiatry practice at 210-450-6450 and ask to speak to the manager about ECT. Let them know you would like to schedule an ECT consult. You will have an initial visit with us where we will explain everything in detail and answer any questions you may have. Thank you.